Welcome to Onward podcast. Today we're fortunate enough to have Sue Porter with us, who is the founder of the Wellbeing Clinic in Colchester. Hi Sue, how are you?
Hi Vish, I'm good, thank you. Thanks for having me on.
No worries at all. Thank you for jumping on with us. So I'm going to kick things off and just kind of start with, why the healthcare industry? Like, was it a childhood dream of yours, or is it something you kind of just fell into?
Yeah, I guess it was a childhood dream, to be honest. I've always been interested in science and the human body, and luckily I was good at it academically. So it was kind of a nice, easy fit for me, really, to then go on to study at university and then keep up to speed with professional development. And fortunately, I have a really good memory, which helps me out a lot with regards to medical conditions and drug names and things. So that's always helpful in this industry. But yeah, it has been. There's been times that I've doubted that journey, like most people in any profession. But at the moment, I'm really fortunate to do something that I really love.
That's amazing. So you haven't always just owned your own healthcare practice, have you? You've actually worked for the public sector for quite a number of years. Was it 10 plus years?
Yeah, I think it has been. I'm just trying to work it out. So, yeah, people work out my age. But yeah, it's at least 10 years of public sector work that I've done. And some of that time was spent within local authority settings as well, when public health was moved into local authority work from the NHS. I worked for quite a long time doing consulting for London boroughs. Even throughout the COVID years, I was doing that in terms of advising on the public health strategy sitting behind reducing numbers of people that were contracting COVID. So with the exception of a couple of bits of private work that I've done, until now, obviously it being a private business, I have been solely public sector, which has its challenges in terms of mindset, because often I forget to charge people, or I'll be like, oh, I'll do it for free, or, those kind of things. But now, obviously, the benefit of having a team behind me and other doctors within the business, it's made us a lot more kind of clear on our offering, and other people kind of have those jobs. So, but it's nice to have that public sector mindset. I do truly care about each and every one of our patients, and we do go up above and beyond. And that's what people come back for. They understand that it's not just about coming to an appointment and paying for a service. We're kind of managing their health really going forwards, which is nice.
And do you find that from like NHS to private, there's a massive difference? Because I know that I've been through NHS and I've been fortunate enough to go through private, and oh my God, private is just a different world. It's just like everything is instant. I remember having my appendix out when I was younger, and honestly, I couldn't believe it. I was in was it Royal London Hospital in Mile End? I can't remember if it was that. But I was there for a few days with my appendix causing me a lot of pain, and they needed to be removed. And I jumped into private, and I'm not even joking. I was in NHS for about 3 days on a drip. I went into private, and the same night I had a consultation, my procedure, and I was awake eating my first little sandwich they gave me in my private little room. It's a complete different world, isn't it, private?
It is. I think it really does have its place in the healthcare system, and the private sector is being utilised a lot by the NHS currently. There's been a lot of people that have had NHS operations in private hospitals. There's been a lot of people that have been referred to different consultants that normally only work privately, for instance, just to meet the backlogs. So there really is a blurring of the two. But private sector healthcare, the thing for me is just having the time with each patient, the time to fully understand their medical history, their symptoms, but also being able to do more for those things and recommend elements of whether it's lifestyle or dietary changes, for instance, that can help, that aren't necessarily within the NICE guidelines that the GP has to follow. So, for instance, one of the things for me that I've really noticed over the years is the thresholds for vitamins on the NHS has decreased. So it's not really about kind of clinical excellence. anymore. It's about what can we afford as a healthcare system to fund to meet the overall population needs of that cohort of people that are signed up to each GP surgery. So to give you an example, the optimum levels of vitamin D are between 120 and 375. Years ago, anything below 75 was deemed as deficient in vitamin D. Then more recently, it's been anything below 50 has been deemed deficient in vitamin D. And then in the last 6 months, it's been GPs will only support anything under 25 for vitamin D. So you're looking at 100 units away from the optimal level. And at that level, when vitamin D levels are lower than 25, particularly in postmenopausal women, for instance, or people that don't do weight-bearing exercise or have a family history of osteoporosis and things, it is a massive risk factor. And considering the cost that's attached to falls of elderly and breaks and how that affects someone's quality of life, and then obviously needing to go into the care system, which is incredibly costly. In fact, I know from working in the council, in Essex County Council, that of the £2 billion budget they have each year, half of that is spent on social care in Essex.
Wow.
So why are we kind of making decisions within primary care that's going to have a knock-on effect to our colleagues in a different public sector organisation when we need to reduce our care bill because of the ageing population? And I don't really understand the background to some of those decisions, but I do know that they have massive repercussions for the population. People that we see that have anything from memory loss to sleep problems to achy joints, achy bones, low testosterone in men. Vitamin D is very closely correlated with. We see a lot of that with regards to men's mental health, which is obviously a massive public health issue as well, with suicide rates, for instance, and loads of other conditions that link to low vitamin D. Particularly, there's a lot of evidence around low vitamin D causing more heart conditions and low vitamin D causing more autoimmune conditions. So commissioning decisions that have been made for whatever reason, likely cost, we see have massive bearings. Now, if I was working in the NHS, I wouldn't be able to say to somebody, you need to be prescribed vitamin D at this level. But obviously working privately, we can advise that somebody has vitamin D supplements to increase their levels, even when they're not deemed as NHS low.
Wow, that's absolutely crazy. It sounds like they're being more reactive than proactive, trying to, find solutions.
Yeah, and it's a tricky one, having in that space from a management perspective as well. I've done a lot of costing work within the NHS, and I can see why decisions like that are made, because obviously, when you're looking at actually you can vaccinate 100,000 people for cheaper than you can prescribe a course of, vitamin D supplements or B12 injections or whatever it may be, you can see why those decisions are made. But in terms of quantifying the long-term benefit and the flip of that, really, the cost of doing that is so hard to quantify that all we actually see is that actually falls have increased, long-term social care costs have increased, and then that's just put down to things like the ageing population. And actually, it's so hard to attribute to actually a decision that's made at primary care level that it gets forgotten. And I'm a big believer in what doesn't get measured gets forgotten. And I know firsthand from my patients the difference some of this vitamin therapy makes to their lives, that it makes me incredibly passionate about working with them to improve their health, rather than just working from a set of guidelines that largely are very fit for purpose, but there are some questionable decisions in there, in my personal opinion.
And this is a bit off the topic, but do you think there is, or do you think there will be in the future a shortage of staff like nurses and doctors, and that's then going to take another toll on the NHS and maybe even private?
Yeah, I think there will be. I think particularly in the doctor cohort, nurses, I think a lot of people aspire to be nurses, and I think also nurses, not to belittle them in any way, but they don't have the life upheaval as much as what doctors do, with regards to, for instance, having to basically travel all around the country, go to whichever deanery you need to go to, move your kids out of school just to get a job, to take it, like my best friend, she took a year off to get married just to ensure that she didn't have to work on her wedding day, because the shifts are obviously done
Oh,
6
wow.
weeks in advance. The Christmases that you have to sacrifice, the birthdays, all those things, the sports days that we all kind of take for granted as being able to just take a day off. It doesn't work like that in the profession. It doesn't work often for nurses as well, I must say. But particularly with doctors at the moment, particularly with the pay and conditions dispute, and it's not necessarily so much about the pay. Yes, I don't think it's right that someone should get paid more to stack shelves in Lidl than they should to be in charge of a hospital in terms of an hourly rate. But I think a lot of doctors are lobbying for change to conditions in terms of 100-hour weeks not being safe, and the stress levels, and attached to that the pay, and also the conditions with regards to things like annual leave. It's a massive sacrifice for someone to dedicate their life to medicine, that I think a lot of people have had enough, even at consultant level, and are leaving to do just private work, or they're GPs and they're leaving to go to Australia or New Zealand or somewhere where there's a better quality of life without the stresses that are attached. I don't know a GP that works full-time in the NHS. I literally can't think of one person that works full-time because of the stresses attached to that. And with the shortage of doctors anyway, the fact that most of them are choosing to work part-time for a number of reasons, I think is just creating an inherent system problem. And it costs £250,000 to train every doctor. So even though people are paying student fees, the cost to the government is still £250,000 to train every doctor. So if they're then leaving the profession, or leaving the country, or giving up entirely, like some of my friends have, then that cost is never retracted back really into the system. And I think for that reason, it's a bit of a sinking ship with regards to keeping the NHS alive. They are looking at other ways to sustain that. Like there's a whole profession called MAPS, which are a group of professionals like physician associates, anaesthesia associates, which are not doctors, but they do have a lot of powers in terms of diagnosis and getting things signed off. And there are a lot of other professions that have been upskilled, like paramedics, like prescribing nurses, like pharmacists, that are now taking on more of that role. And I think that is important. But I personally believe that because of the sacrifices that so many doctors have had to make, there is a bit of a system tension, because they're essentially seeing these new professions come into it with often the same level of pay, but without the sacrifices being made in terms of that.
Did you say that they're working 100-hour weeks?
Yeah.
Because that's crazy. Because even if they're working part-time, that sounds like they're working a full-time job anyway. Because 100-hour weeks are that's a lot if they're doing that consistently. That's I think even as a business owner, 100-hour weeks, you can work them for a few weeks, but to consistently work that, God, that would burn me out no matter how much I love what I was doing.
Yeah, precisely. And that 100-hour weeks, just to be clear, kind of applies more to the kind of junior doctor model than, say, a GP. I'm sure there are GPs that work 100-hour weeks. I don't doubt that. But it's almost as if there's this kind of cultural thing, as you've done 5 years of medicine, then you're in charge of a hospital on your own. And then you can call a consultant, but obviously there are situations where you will have to manage things because of time is of the essence. I remember my best friend calling me up one time when she was in charge of Brighton Hospital, and just in tears saying, I don't know what to do. And I was like, well, where are you now? And she was like, I'm hiding in the broom cupboard because I just don't know how to deal with what's going on. And this is a very resilient, straight A student whose family are medics, that I've never even seen in tears about anything before, having to have that level of kind of overwhelm just with the system. So to get through that, you almost wear this badge of honour. And then I think that does account, in my opinion, to some of the resistance to these new professions coming on board. Because they think, well, you haven't earned your stripes, you haven't had to do this, and yet you're being paid the same as me. You're able to diagnose things in the future. You'll probably be able to prescribe the same things. And people are like, well, why did I do this? Why have I put myself through this? And I don't think the government's being particularly helpful with the narrative that surrounds that, because there's a lot of follow the kind of debate on Twitter. And there's a lot of doctors that are basically saying that they're leaving over it. They can't believe that there's this new kind of profession that is taking shifts. They're allowed to take junior doctor shifts and things like that, and they're not able to get jobs, but they're advertising other cheaper posts to be filled. And so it's certainly something, I think there's space for every profession in the health field, but I think because of this culture of it's so hard to get to the point of being a GP or a consultant or even a registrar, that there's this cultural issue which is making it quite impenetrable for other similar level professionals to come through and help take the load.
And do you think maybe, again, this is kind of me just thinking outside the box a bit, but do you think like AI and robots is actually going to be a good thing for the healthcare industry, because they can then take on workloads which may be lacking?
I think it is a good thing. I think, they are already used to some extent. Like, for instance, Colchester Hospital has got 5 or 6 robotic surgery robots that are used very frequently or daily for gynae operations and things like that. One of my best friends, she had a hysterectomy recently by a robot at Colchester Hospital. And they're not cheap. I believe they cost about £2 million each, but they are good. And they do save a lot of time and create cleaner incisions and things like that. But I don't think it solves the problem. I think there's such an institutional issue, mainly not due to anyone's fault, but mainly just to the size of the NHS and everything it tries to achieve. I know that when I've worked in management within it before, anything from, procurement decisions that are made, you've got to try and appease different consultants and ordering different things, so you can't get the economies of scale. And then there's so much waste, there's so many missed appointments, there's so many, things that happen that cost more than what you think. It's so hard to kind of plan for these eventualities, especially when something like COVID happens, that the system has to support there, but you just constantly overspend or can't, work within your budget because of the nature of it being such a huge system. So I think robots will help to a degree, but they're not the solution, because also they haven't got the human component of being able to have empathy, to understand people, to have discussions with people about their health, to manage the risks and benefits, and all that kind of stuff. They'll never replace consultations, but if they can obviously do some procedures, then great. But we do have to worry about the future of AI. I think it's great to a point, but I do think, I know there's been studies done where robots have been turned on and they've had to turn them off because they've realised they've started communicating with each other. Like, linguistic specialists have been brought in and been like, turn them off. They're communicating in a way that we don't understand, but I know they're communicating with each other. So we do have to kind of be mindful of that kind of short circuit kind of robots taking over. We don't really know what we're creating. And I find that we do this a lot in history. I mean, when we were growing up in the 90s, I remember learning at school, plastics, they take 100 years to degrade. There's nothing that kind of breaks them down. We shouldn't really use them. And here we are, 30 odd years later, and we're all still using single-use plastic. And you think, what person at the top allows this kind of continuation? But the problem is the world is such a huge place. There isn't one person at the top that makes these decisions. Companies just do things. And then by the time laws change, it's, 30 years down the line and we've got a bigger problem. And I think that's very true of kind of NHS healthcare decisions as well, if I'm honest.
No, that's a really good insight, to be fair. Going back to you actually started your own, obviously, wellbeing clinic in Colchester. And what was your journey into that? Because I know we briefly spoke about this a few weeks ago, and I was really inspired. You know,
Thank
you
you.
taking that, like you took that plunge, didn't you? And you used your own personal finances to start it up, and then COVID happened. And then correct me if I'm wrong, but did you say that? Did you say that you gave birth to your child and went back to work in like 10 days or something like
Yep,
that?
I
Tell
did.
us more about that. God, what? I'd love to know a bit more about that if you don't mind sharing it.
Yeah, of course. Yeah, absolutely. Yeah, so that is the mad thing. I mean, you know, you put me on my box or whatever they call it, where I have a bit of a rant. But you know, I think I'm not the only woman business owner to have to do that. You know, the business wouldn't have survived if I didn't come back to work. It's the nature of being a small business, unfortunately, with employees, is that if you don't work, then you can't afford to take 6 months off. You know, I've got patients and clients that, you know, would go somewhere else, you know, because there isn't, well, I know there's not loads of alternatives, but, you know, if I wasn't supporting their health, they would have no choice but to go somewhere else. So it wasn't something that I particularly chose to do. It was more of a necessity. And also, like any female business owner, you know, who can survive on, you know, maternity for you know, the basic £400 a month from the government. You know, that didn't even pay for my car at the time, you know, let alone, you know, half the
Yeah.
mortgage, food, bills, cost of living, interest rates increasing. So as much as I like to think, you know, yes, I did really well with that, I actually didn't have a choice. And is something quite weird about going back to work after going through that. I remember, you know, I was, you know, speak medically, you know, I was still bleeding, my nipples were still oozing, you know, I literally just wanted to get home. You know, the show must go on. And I think that is something, again, from a, not meaning to go on too much about politics, but you know, I think more does have to be done to support female business owners, because small businesses are so integral to our society and our communities. And yet I, as a very kind of, you know, strong individual that will kind of do anything, nearly chucked the towel in because it was all a bit too much. And I know many that have had to do that. And it's such a shame, you know, it's such a shame. And I've got friends that have taken, you know, a year off and things, or been paid for a year, or been paid for 6 months. And, you know, that's lovely. And I probably wouldn't have done that knowing my personality anyway. But it is lovely to have that option, but it's just obviously not mimicked for business owners. So, you know, what doesn't kill you makes you stronger. And here we are. And I'm glad that I did continue. And my son is alive and well. And don't get me wrong, I get mum guilt. But, you know, I love what I do, and I've got a great team, and if I don't work, you know, that would affect other people in the business as well. So it's like anything in life, a balance. And I'm glad that I did it.
I think that shows so much resilience, doesn't it? That no matter what you've been through, you've shown up and you've turned up, and no matter how hard it was, you understood and appreciated that it was sort of like, if I don't turn up, then nobody else is going to be able to fill the shoes. So it's an absolute inspiration, really. And I don't think that's just for young women. I think that's for everyone to take on board that life does get tough and life does get really hard, but you have to find a solution. We can't shy away from it, can we?
Exactly.
And I was actually gonna say, because in your clinic you do a couple of key services, and I think it was the women and men's MOT checks, and I'd love to know personally, like, I'm useless with the healthcare stuff for myself. Like, honestly, I'm terrible. I just about take my vitamins every day if I remember. But but I'd love to know what it is that the MOT checks actually do in a nutshell, if that's even possible.
Yeah, of course. So what we do as part of that is we do some basic physiological checks. So we do tests like pulse rate, blood pressure, oxygen saturation. We talk to you about your medical history, whether you've got any diagnoses, what your family history is, what medications, if any, that you take. what symptoms that you get, whether you've had any surgeries, just get a really good understanding of what's going on. Then we take very comprehensive bloods. So we basically test for a very vast array of things, much more comprehensive than what you would have done even as a big milestone birthday NHS check. Or if you went in with symptoms and, you would test a few things based on what you've got symptoms relating to. So, for instance, just to give you an overview, we test the full blood count, which is basically all the red blood cells, the white blood cells, the platelets. We test for inflammatory markers, which give us an idea of disease and inflammation within the body. We test for the full cholesterol profile, someone's full iron profile, full hormone profile, full thyroid profile, including the thyroid antibodies. We look at minerals. We look at blood glucose levels, uric acid levels. We look at vitamins, if I didn't already say that. You name it, we test for it. For males that are over the age of 40, we test for prostate-specific antigens for prostate cancer risk. And we can test other factors for women if we deem that they're clinically appropriate, like, for instance, tumour markers or bleeding markers, things like that. So we usually also will give someone, if they're happy to, a stool sample test to do, take home, and then send off directly to the lab themselves, just because there's such a high incidence of bowel and colon cancer, even in youngsters these days, that we just rule out that anything is happening in that regard as well. So what you get back is basically like a 30-page lab report that has explained to you what the markers are, rather than just like what you see on the NHS app where you think, I don't know what this means. You actually get explanation about all of the things and where you are on the scale. So whether you're deemed as high, low, normal. And then we go through it as a follow-up. It's what I'm doing after this call, actually, 2 people's follows up. To say where you are and how that links back to their medical history, signs and symptoms. If, for instance, any of those physiological checks came back, like, for instance, blood pressure was high or heart rate was low, then we usually do a 12-lead ECG as well. And we have a clinic cardiologist who then looks at those and signs them off and then advises me or one of our nurses what needs to be done. So we do a lot of Holter monitors, we do a lot of echocardiograms, which is an ultrasound of the heart to see what's going on, just to check that there's no heart issues. And if there is, obviously, then we treat them or write to someone's GP or whatever needs to be done, really. So what we usually do with the person's consent is write to their GP and share the results with them, because then they've got a record of everything linking to their health, which I think is a really nice thing to do, because then it takes that pressure off the NHS as well. They've got, results that they might otherwise have to pay for. And it keeps that kind of family GP model alive, even though it's not that alive these days with regards to knowing much more about your patient. Then often if someone's not private or not self-pay, then they then go to their GP and get a referral if needed via their GP. But if they want to go privately or self-pay, we organise consultant appointments usually within a week for them. So most of the time we can get consultant appointments within a week for someone, whether it's dermatology, whether it's cardiology, whether it's urology, rheumatology. So there is that option for people. And I think people think it's going to cost the earth, but most consultant appointments are about £200, which is a lot of money. But for most people, it's not going to break the bank. And rather than waiting a year to 2 years for an NHS appointment, it's sometimes preferable for some people.
For sure. And I think one of the things that you actually spoke about on your MOTs as a guy, it's quite to my understanding, it's quite a vulnerable procedure, the prostate side of things. How does that work? Because as a guy, how can I feel more comfortable coming into somewhere like yourself and going, I need to get this checked? Because it is quite intimidating.
Yeah. So we treat every appointment with full confidentiality. We deal with this kind of stuff all the time. We've seen everything really throughout our kind of careers. and we reassure you on that basis. For prostate checks, we just do a blood test when it's our core team to look for prostate-specific antigens. And depending on your age, what that level is, we then would refer you to a urologist if that was high. And we have a urologist here as well, so I often run results past him as well.
You said blood test. I thought it was a lot more intimidating than a blood test, or is this something new that's come out?
So it's not that new. It's been around, I'm not sure how long, but quite a long time. And it basically is a very specific blood test for prostate antigens, and prostate antigens increase when you've got an enlarged prostate or prostate cancer. So what happens is, if your levels are high from the blood test, is then we refer you to a urologist, and they can either do an examination of the prostate, which they do with a chaperone, or you can just, like some of my patients have said, look, I really don't want that examination, and they just have an MRI scan, because often all the urologist can feel is an enlarged prostate, and then you need to do an MRI anyway. So it's not necessarily a super required step to have that. So you can skip it. And that, I think, a lot of men worry about, and they think, dear, I might have a problem because I'm waking up more than once in the night to go for a wee, or I'm worried that my flow rate's changed, or I'm getting intermittent urine, but I really don't want, someone to examine my prostate. But actually that's not necessary. It shouldn't put you off of doing it. There are ways around it, but the blood test marker is really good on its own, just to tell you what your risk is. So I think that reassures a lot.
Yeah, as a guy, I didn't know that. That's something I wish was. I guess for me personally, I'm quite young, so I'm not in that age bracket. But for the older gentlemen who are listening to this, I guess that's really good information for them to have, because I personally didn't know that existed. So thank you so much for sharing that. Hopefully that will actually encourage people to get examined if they are having those issues. So that's really appreciate that.
Indeed, yeah. And I think it's also worth men knowing that, if we test prostate specific antigens, the cost is about £60. We can do it at any age. Yeah. We can do it at any age. You don't have to wait till you're over 40. So particularly if there's a family history of non-smoking lung cancers or breast cancer in the family, then you're more at risk of developing prostate cancer. And we have had a couple of 39-year-olds that we've had to refer for prostate cancer because we've done the check, whereas ordinarily they wouldn't be checked till much later on the NHS. And by that point, it could have been too late for them. We also usually refer when prostate antigens are above 3 in somebody that's older than 50. And the reason we do that is because the NHS guideline is about 4.5 for referral. But again, often that's too late. Often by that point, about 25% of the cases are prostate cancer. So to have a referral sooner than that obviously takes away the time lag loss. And obviously because it's private, we can basically refer when we want. So there's a lot of merit in doing that. And so I'd say to any man, particularly men over the age of 50, make sure that you have, even if it's once every 3 years, a PSA test. And if you've got any symptoms at all, really you should have an annual check of PSA or see a urologist, or at least have the PSA test so you know what's going on. Because I was fortunate enough that my dad had prostate cancer, but because both myself and him had worked with urologists, we had contacts. So very quickly he went straight in for radiotherapy called brachytherapy, which is very unintrusive, and it was cured. Whereas unfortunately I've got patients that have had to have their prostates removed, and unfortunately at the moment I've got a patient who they didn't come in till too late, and it had already spread to their bones, and they're now terminal. So time really is of the essence with any cancer. But to think that so many men are scared off checking because of an examination is really a narrative that needs to be changed.
Absolutely, 100%. I couldn't agree with you more. I know where it's very, where there's not enough education behind it, it's scary. Like I was trying to find better words to say, but it's terrifying. Taking up the courage to go to the doctors and saying to them, "Oh, I want to do this," and then you feel like there's going to be judgment, and then you have to actually go have this procedure, and it's quite emasculating, I guess, for some men. But to know that there's a blood test and MRI scans and all of these other ways to do the same thing is quite enlightening, and hopefully people listening to this can get a breath of fresh air from that. But moving on from this, I'd love to know, like, to kind of end the podcast, is where do you see the clinic going, and what have you got any future plans for it? Because I know you're currently taking on like really specialist consultants as well, haven't you?
Yeah, to be honest, it's one of those pinch me moments when my business partner's now a world-renowned cardiologist, and I've got this amazing team. When you think about 2 years ago, I nearly chucked it all in. And we are blessed to have some amazing friends and consultants here. And for me, that's re-energised the plan of really wanting to have a wellbeing clinic in every town in Essex, would be, in the 10-year plan. I can't see us doing anything with regards to a second one until next year. But interestingly, just this week, we've had a lot of interest in our rooms with regards to other healthcare professionals. So we might branch upstairs next year, because we've got 3 treatment rooms at the moment. So it'd be nice to have another 3. And then potentially we're looking for next year to get a clinic in either Dunmow or Chelmsford. And then, who knows how quickly things change. But it's one of those things that kind of snowballs in a positive way, where suddenly it's got traction, and we've got incredible cheerleaders, we've got fantastic reviews, we've got a fantastic team, and suddenly it just starts to self-perpetuate. And that's something that I'm really proud of. And who knows what the future holds. Hopefully it's positive, and hopefully it continues to grow, and we help and save more lives, and support people better with their health.
That's absolutely incredible. Like, just to kind of recap here, this is something that you've left the NHS or the public sector to start on your own journey. Then through that, you've had a child, and you've had to go back to work and go through the struggles of that. You've most likely invested a considerable amount of your own personal savings into something which was just, I guess, a vision to start off with. And like, now you're looking to expand into more cities and help more people and inspire more people to kind of be on the more, the health kick journey, which is just, wow, that's absolutely incredible. You guys should be so, so, so proud of yourselves. It's like, what a journey you've been on. And, you've been such a good leader for the team, haven't you? Like, that's really, really inspiring for so many people.
Thank you. Yeah, it's, I'm proud of it. It's not been the easiest journey, and I'm sure some of the team would probably say I've not been the best leader at times, but I've done my best. I can put my hand on my heart and say that. And let's see what the future holds. But I am really proud of it, and but I like to stay humble as well with it, and like to kind of take all opportunities and look at them on face value as well, and make good decisions about how we progress forwards. But I certainly am proud to have helped so many people and saved so many lives by doing something that I love. And always learning. I've got another master's degree starting this September, so onwards and upwards with an under 2-year-old.
That's absolutely phenomenal. No, I've also got a dog, not the kid, but oh my god, the puppies are hard work. That's a podcast in itself.
7 now, but it's still a walk every day. It's still something that you got to factor in. We joke, most days I don't even get time to go for a wee, and it's like a luxury when I do. And we joke that we haven't got a kitchen in the clinic, and I'm like, well, you don't have time to eat when you come to work, like, so all these kind of little day-to-day luxuries that we've kind of forgotten are normal. But it's a funny different mindset. But fitting in time for a dog walk is a killer. And fortunately, my parents are very good at helping out with that, and it just takes the pressure off. And the little ones in nursery, so all these things that makes it possible. It takes a village, doesn't it, these days, to raise a puppy or a child.
It absolutely does. It's so important to have that community around you to support you. But I want to ask you one last question. This is for the young
Mm.
people coming up and want to get into the healthcare industry. But it's a daunting experience. It's a long experience. It's challenging mentally, emotionally, and physically. Those 100-hour weeks are going to deter them rather than inspire them. What can you say to kind of encourage these people to kind of continue their path into the healthcare industry?
I think it's really important to remember the breadth of the industry. I remember when I did my medical work experience, and my friend's dad was kind of adamant that I shouldn't be a GP. But he said, "There's just do it, just do the training, and there's so many opportunities." And I think that's still, well, I think that's even more true today. So if you're in two minds about, dedicating your life to the NHS, remember that there are other options. Remember that you can literally do anything once you've got that qualification within that scope of practice. Remember that the healthcare system is changing all the time. I do think there's a lot of spotlight on the system at the moment, and I do think that things will change for the better in time. So I think don't judge the situation as it is at the moment necessarily, but think about, all the years you've got to train. I remember when I went to uni in 2004, and I remember thinking, wow, 2007, 2009, that seems so long away. And I never thought it would happen. And here we are, and
Hmm.
in 2024, and time passes anyway. So you might as well do something that you want to do, because the time will pass, even if you can't imagine it being, 2040 or whatever. It will happen, and it's just what you've done with that time. So I think that's just important. And reach out to lots of different healthcare professionals. There's so many options, whether it's physiotherapy, whether it's physiology, whether it's osteopathy, chiropractic, nutrition, nursing, whatever it might be. There's so many options. So I think it's important to make the right decision at the start, because then obviously you're more likely to not have to retrain in something as well.
Wow, that's inspiring words coming from someone who's, in my eyes, made it and continuing to, push on that with your degree, as you mentioned, and opening new branches. And I wish you genuinely from the bottom of my heart, I wish you all the best in all of that. And I know I'll be supporting your journey 100%, because I know I need to do something more on my healthcare. So I may be knocking on your door soon with in regards to getting one of those MOT tests. Yeah, I
Yeah,
think it's important to be
definitely. Yeah,
proactive on
and
it.
thank you for saying. I'm sure your business will be equally as successful, if not more successful. You just started the journey later than me, and that's the only difference as far as I'm concerned. But there's definitely something we can
Oh.
do with regards to referrals as well for the services that you offer.
Oh, I really appreciate that. Thank you, Sue. I'm going to just take this opportunity to say thank you so much for being with us today.
Yeah,
I had
thank you
a
for having
really good
me.
conversation, so thank you so much.